children, staff and school community of St. Lawrence O'Toole's National School that I used to teach in, who are opening their new school building today. I believe the Minister is opening the building. I cannot be with them because of this morning's debate, but they know that I love them very much and that they're with me always. Minister, if we were to invite a family member of every individual who has died from drug overdose last year to sit in this chamber, we wouldn't have enough room for everybody. This is the most famous room in Ireland. These seats have been filled by famous people over the last 100 years or so. If we were to invite a single family member for every individual who has died from drug overdose in Ireland to sit here, we wouldn't have enough room. They'd have to sit in the public gallery. In 2017, 235 people died from fatal overdoses of drugs. That figure gets worse year on year, and we have one of the highest drug overdose rates in Europe. And if they were to come here, if those family members were to come here, Minister, if they were to sit in these seats, what would we say to them? I suppose we'd want to understand about the complexity of the issue. We'd want to show compassion. We'd want, I suppose, to listen to experts who would say that there's overlapping issues of poverty, of disadvantage, of alienation that leads somebody into drug use and addiction. We'd want to understand that. But fundamentally, Minister, what would actually happen, if we were to be honest, is that we'd look at each and one of those family members and we would say to them from the political system that the person that they loved who died was a criminal. Was a criminal. And that is the centre of what we're trying to change in our debate this morning. The Labour Party wants to stand with those family members. It wants to stand with those in addiction, wants to stand with those who are suffering, wants to stand with those who are in recovery, and say to them quite plainly and simply that you are not a criminal. Criminality and the criminalisation of the drug user is part of a stigma. It's part of a shame culture. It's a deliberate act of public policy. And the way it is, Minister, is that it is not drugs that kills people as much as bad drug policy. And what we in the Labour Party want to say today is that we don't need a war on drugs. We need a war on bad drug policy. Because this criminalisation and this stigmatising of people in addiction, it leads to people in the political system undermining and dehumanising those people who need support and who need compassion. It leads to a cabinet minister throwing leaflets around her own constituency, telling her constituents that the medical centre newly opened in her area won't be dealing methadone. It leads to a backbencher using dehumanising language when talking about somebody in addiction. It leads to, I might say, the most ineffective and absent senior and junior minister responsible for this area in a generation. Because the feeling from the political system is what you're doing, what you are, is criminal, and what you are is worthless. And it's not just the political system that feels that. The medical system feels it too. My colleague Marie Sherlock tells me that in Dublin, only 28% of GPs are involved in the methadone programme. And that's replicated right throughout the country. And it leads to a bizarre situation, Minister, where people, as Father Peter McVerry told us on Monday night, are travelling from Wexford to Dublin in order to get their methadone. And I know this to be true because I once met a woman called Lisa. And Lisa was living in Portlaoise. She was a young mother. And she used to travel from Portlaoise to Dublin every single day on a bus to get her methadone. And the sad thing was for me when engaging with Lisa was that she felt she wasn't worth any more than that. She couldn't demand any better service than that because she felt on some level perhaps that she was a criminal, that she was worthless. And this young mother, we forced her to go from Portlaoise to Dublin every day on a bus over and back to get her methadone. I called into that centre a number of months later. I asked about Lisa, and I was told that she didn't make it. She didn't survive. We killed her. She wasn't a criminal. She wasn't worthless. And I can think of people, a man I knew called Paul, who had a daughter who has cystic fibrosis. And Minister, you should have seen the way they interacted with each other. They loved each other so deeply. The sparkle in her eyes when she saw him, the way that they used to spend time together. He wasn't well, and she wasn't well. And she didn't make it because of her illness. And as a result, he didn't make it because of his illness. And he isn't a criminal, and he wasn't worthless. But I noticed from the debate around the injecting facility, which was passed by this Oireachtas in 2017, Minister. What would any of us say if we came across a dead body in a laneway from a heroin overdose and we held that body in our arms? Would we say to that person, well, look, it was just tied up in the High Court. There was nothing we could do. It's planning. People are literally dying in the alleyways of our capital city. And we haven't made the intervention which is necessary in order to save those lives, which we could have done from a mobile facility that could have been enacted through emergency legislation. We haven't done it. It is us who are the criminals. We are the ones who are useless. Our inaction is criminal, not those who are dying. Freddie McMahon, whose brother died of drug-related issues, the former Dublin footballer, says that we need a tribe. We need a tribe for change. And I can speak of people in this house who are part of that tribe. I remember trying with my Labour colleagues to get this injecting centre idea over the line. And it was people like Pascal Donoghue in Fine Gael who were supportive. It was people like John O'Brien in Sinn Féin who were supportive. Even today, I hear people like Paul McAuliffe from Fianna Fáil making good speeches on decriminalisation. I know my colleagues like Nessa Horrigan from the Greens and Holly Cairns from the Social Democrats and Lynn Rowan, the independent senator, are speaking seriously about this issue. I think of people like Gino Kenny, who's been a warrior in this field. I think we absolutely do need a tribe that will change this conversation away from criminality and worthlessness to one that replicates what happened in Portugal. Because, Minister, what happened in Portugal 20 years ago, when they decriminalised the drug user, after 20 years, they have half the numbers of people in drug dependency programs, and they've reduced their drug overdose rate by 75%. So our call in the Labour Party today is quite simple. We stand with those who are affected by this issue. You are absolutely not criminal. You are absolutely not worthless. And we need the Irish people to understand and completely recast our view of this whole debate. You've promised the Citizens' Assembly on drugs. We need that Citizens' Assembly on drugs, Minister, because quite frankly, People are dying. They're dying on our watch. And it is our inaction that is criminal.
With your indulgence, I'm going to take the second slot, and my colleague will take the last 5 minutes. Láthcheann Comhairle, this is truly an important debate. And I have to say, it is disappointing that other than the Labour Party members, that the only member present is the junior minister who's going to respond to it. Because what our spokesperson, Dáil Éireann, is doing in crafting this comprehensive motion, this thoughtful motion, is shining a light on an issue that impacts on every community in our country, on every village, every town, every city, and every rural area. And everyone in this House knows that. We know that we have a massive issue with drug abuse, with drug-related illnesses and deaths. We also know that there is unimaginable hurt, some just described by Deputy Éireann, unimaginable pain being felt by families in all our constituencies every day. And because of the nature of this issue, it is almost unspeakable. It is silent, a hurt that needs now to be addressed. The cold statistics set out in our motion should shock each of us, because these cold facts tell us one thing: our current strategies are not working. The situation is getting worse. It's disimproving. And in any other sphere of public policy, and I've been a policy-focused person all my career here, when faced with those sort of realities, that inescapable truth, the response is to change tack, to see what actually works internationally, and to implement change. Now, I know that this is an uncomfortable discussion for many. When faced with challenging societal issues in the past, we put in place a most useful device, a citizens' assembly, an idea that was originally championed by our former leader, Eamon Gilmore, and that I think that has proven its worth, that has helped Ireland rethink issues, difficult issues, based on fundamental evidence and fact. And we urgently need that now, the long-promised Citizens' Assembly on drugs. We must hear from those affected. We must hear from those dealing with the drugs issue, from the health side, from the rehabilitation side, from the administration of justice side too. And I believe that we will hear both a harrowing tale, but an instructive one. And I believe that from whatever angle you come to this issue, you will come to the same conclusion, and that is that we need a change of policy. Marginalisation and criminalisation has failed. It has failed here, and it has failed elsewhere. The experience of the United States is instructive, Láthcheann Comhairle. There was a political pressure, going back to Bill Clinton's time, to be strong on drugs, and you had a mass policy of arrest and incarceration. The prison population has mushroomed beyond all imagination. Enormous resources have been deployed and communities ghettoised to no good effect. And others, as Éireann has said, have done much better. The Portuguese experience is instructive. They criminalised the user while maintaining criminal penalties for those trafficking and selling drugs. They developed a comprehensive system. I haven't time to go into it here, but it's instructive that we look at it, learn from it. Our motion calls for a change of tack, for a focus on this issue that we all know is impacting on us all. I ask that the government would look positively at it, that would act instantly to create the Citizens' Assembly, and let the voice that is not heard right now of the thousands of our citizens that are hurting be heard, and let us see what we can do to make things better for them and not continue on a path which is self-evidently not working.
Thank you, Alaska and Corla. I'm very glad to put my name to this motion, because if you look, read and interpret what the motion says, it says that during the past 25 years of law enforcement approaches to drug use, drug-related deaths have increased by 225%, compared to a 68% reduction in road deaths in the same period, with the total number of such deaths well exceeding 10,500 people. 10,500 lives, 10,500 families. The multiplier in terms of the consequences of this are horrific to imagine. Ireland now has the joint highest rate of drug-induced deaths amongst 16 to 64-year-olds in the European Union. The number of people prosecuted for possession of personal use has increased over that period by 484%, with more than 250,000 convictions recorded for that offence. In the same period, there has been a substantial overall increase in drug use, with use of cocaine rising by 10,000% approximately, and benzodiazepines by 1,800%, and cannabis by 263%. Drug use and its harmful effects, including crimes of violence, intimidation, and extortion aimed at addicts, their families and their communities, are no longer urban phenomena and are spread across the state. Quite simply, Minister, I represent the constituency of Cork East. I have first-hand experience of witnessing deals taking place within my neighbourhood. I have first-hand experience of seeing the prevalence of usage on a recreational basis, particularly in relation to cocaine. It has become normalised in our society, and we can't keep burying our heads in the sand. The criminal justice response, to my mind, and I would have been an advocate, a strong advocate for stronger policing, it has not worked. And if I look at statistics in relation to crime figures which are issued to joint policing committees such as those in Cork County Council, detections of possession of drugs for sale or supply across the city and county fell by 351 between January and August last year to 263 in the same period this year, representing a decrease of 26%. Now, the dogs in the street know that drug use and sale and supply is increasing, but the policing response, I suggest anecdotally, that I think the policing response is moving away. The resources are not there. So I think we need the community health response now. And I think if you talk to members of An Garda Síochána privately, off the record, they will say the same thing. It is beyond policing, and it is beyond a criminal justice thought process or framework in relation to how it's being tackled. Having said all of that, and the motion is very clear, is that we still have to ensure that you go after the drug cartels and the Mr. Bigs of this world, who we now see the influence seeping down into communities where monies from drug use, from recreational use by, I would say middle-class kids and kids of all persuasions, and when I say kids, I'm talking about young adults and older, that the money that's procured from drug use is now going into a laundering, and we're seeing that in the procurement of buildings and properties throughout the state, and that needs to be tackled forthwith. But the Portuguese model does offer a solution. It involves a long-term commitment, but it's something that I think we can embrace, and if we embrace the Citizens' Assembly and set that up, let's hear what the citizens have to say, because I think we will be surprised at their response.
I very much welcome this debate to debate the Labour Party motion on drugs policy and to highlight the progress we have made in implementation of the National Drug Strategy. We have made in implementation the National Reducing Harm, Supporting Recovery. And this is, as you know, a health-led approach to drug and alcohol use in Ireland in 2017 to 2025. And the Minister of State, I am responsible for coordinating the implementation of the National Drug Strategy. And I think by treating the use of substances such as a public health issue rather than solely a criminal issue, we can better help individuals, their families, their communities in which we live in. I very much agree with you, Deputy Éireann, that that we have to take the stigma and the shame and the out of people who use drugs, and a health-led approach is the right approach. As you know, that we are aware the programme of government includes the commitment to convene a citizens' assembly to consider matters relating to drug use, and we are very, very committed to establishing the citizens' assembly on drug use, along with the citizens' assembly on future education at the earliest possible opportunity. And the timelines for the reference for the next assemblies will ultimately be a matter for the Oireachtas to agree, but as anticipated, the government will consider the matter early in the new year, and it will be put to the Dáil and Janet Éireann for the debate, and hopefully we'll have that citizens' assembly up running as quickly as possible. Following a mid-term review of the National Drug Strategy, I agreed 6 strategic priorities for the remaining period of the strategy, 2021 to 2025, and the priorities reinforced a health-led approach to drug and alcohol use and captured commitments in the programme for government, and they also reflect our support for the EU Drug Strategy and Action Plan 2021 to 2025. 6 priorities are to strengthen prevention of drug and alcohol use amongst children and young people, enhance access and delivery of drug and alcohol services in the community, develop harm reduction responses and integrated care pathways for high-risk drug users, address the social determinants and consequences of drug use in disadvantaged communities, and promote alternatives to coercive sanctions for drug-related offences, and also strengthen evidence-informed and outcomes-focused practice, services, policies and strategic implementation. And strategic implementation groups have been established to identify actions to implement these priorities under the auspices of the National Oversight Committee. And these groups reflect partnership approach and give a stronger voice to civil society in the implementation of the strategy. Deputy Howland, you talked about prison and you talked about that we need to reduce the harm and take the stigma out, and I think a lot has been done. I think the Gardaí and I think a lot has been done to I suppose the Gardaí with their adult caution scheme, and also we're trying to work with the Department of Justice Health Diversion scheme. A lot has been done beyond, under the radar as well, but also the fact is you talked about Cork East, Deputy, and it's quite obvious drugs are in every village and town around the country, and there is an issue in every village and town that it isn't just an issue now that is in urban areas or anything. It's across Ireland, and we have to deal with that accordingly, and I think we will through a health-led approach, to an education approach, and maybe a justice approach as well. But strategic, the recent National Drug and Alcohol Survey for the period 2019-2020 showed that overall the use of illegal drugs has remained at a similar level to that recorded in 2014-2015 survey, and has identified, unfortunately, the use of increase in the use of cocaine and ecstasy. And the latest data available regarding drug-related deaths showed that in 2017 there were 376 drug-induced deaths, and the number of deaths has fallen in recent years from 401 in 2013. But every death is deeply regrettable for the individual, their family, friends and their communities. And I think, Deputy Éireann, you outlined that very, very poignantly, and that the amount of people wouldn't get into this trial. And I very much agree with that. But the recent data from the National Drug Treatment Report System show that 17,628 cases receiving treatment for drug and alcohol use in 2021. It represents an increase of 14% in 2020, and the majority of these cases were treated in outpatient facilities. And this increase in treatment services reflect the government's commitment to the public health response to drug use and additional resources committed to services. I think we need to do a lot more regarding prevention and education for children and young people regarding drug use. Is one of the critical elements of the remaining years of the National Drug Strategy. And I recently announced 1.5 million allocation for a 3-year drug and alcohol prevention education programme. And this funding programme is a key deliverable under the National Drug Strategy, which aims to strengthen the prevention of drug and alcohol use and related harm amongst children and young people. And this is the first time that national funding is made available for drug prevention with a holistic approach, considering both drug and alcohol use is in an overarching aim to reduce the harmful use of both at an early age. And the initiative will build on local and sectoral initiatives such as Know the Score and draw on evidence from Europe to professionalise and elevate drug prevention practices in Ireland. And this programme will fund projects in 5 prevention settings, including schools, youth and general community, family, environmental, as well as third-level institutions. And funding in the National Drug Strategy has increased significantly over the last 3 years. Budget 2021, 22 and 23 allocate additional 21 million to expand the provision of drug and alcohol services, both residential and community-based services. And over 2 million has been made available through the Community Services Enhancement Fund to fund the provision of community-based drugs and alcohol services. And 25% of the funding is ring-fenced for services for women, ethnic minorities and LGBTI+, and a further 500,000 provided for the CSEF in 2023. And Budget 2023 also provides an uplift of 3.5 million in core funding for community-based drug and alcohol services in order to maintain existing levels of service. And this is the first increase in core funding since 2013. It's a priority in the National Drug Strategy to develop integrated care pathways and harm reduction responses for high-risk drug users. And these high-risk drug users have complex health and social needs that make them vulnerable to drug overdose and ultimately premature death. In 2022, 150,000 was allocated in recurring funding for a HSE-led initiative to reduce the health-related harms associated with the use of cocaine and crack cocaine. And this funding will support services in delivering evidence-based interventions and will increase training opportunities for staff in addiction services nationally, and will also improve the support provided to those affected by adverse health consequences of cocaine or crack cocaine use. And community-based services and CHOs were consulted in developing these initiatives, reflecting the partnership approach which is at the heart of the National Drug Strategy. And a drug monitoring pilot programme was also successfully implemented at this year's Electric Picnic Festival as a response to drug use by people in the nighttime economy, who have traditionally been hit hard to reach by drug and alcohol services. And as a response to the COVID-19 pandemic, people with addiction issues and those who were homeless and marginalised were classed by NEFIT as very vulnerable groups for whom COVID was a risk to their health and safety. And significant additional funding was provided to the HSE to provide OST treatment in 2020 and 2021. A further 4.2 million was secured in Budget 2022 for continued treatment of additional 1,000 clients for an opiate substitution treatment and who were given access to OST in 2020 and 21 under the COVID-19 contingency plan for people who use drugs. And 10 million was provided in 2022 to consolidate and maintain the enhanced provisions of healthcare services for people who are homeless, and these services have greatly minimised the expected number of deaths amongst the homeless population during COVID-19. I've outlined the government's approach to drug use, which is the health-led response, and under my leadership the government has provided significant additional funding to implement the National Drug Strategy. And I have engaged with all stakeholders, you're aware, Deputy Éireann, including community-based drugs and alcohol services, to identify clear priorities for the remaining years of the National Drug Strategy. If I just might say that one issue that I am disappointed with is the National Injecting Facility, and the Government is committed to the establishment of a supervised injecting facility in Dublin City Centre. And as you know, we have passed legislation, but we also identified an area in Dublin. But unfortunately, there are issues with this, and we hope that this gets up in running as quickly as possible. We are waiting on a Board Penala decision, and the facility will bring drug addicting into medical controlled and supervised setting with health and other benefits for vulnerable individuals. But this is an issue that I'm delighted to debate here today, and I think cross-party, cross-government, across community, I think we have to work together to try to address this very difficult issue.
Come back to the Labour Party, and it's Deputy Duncan Smith.
Thank you, Chair. In politics, when the answer is more guards, sometimes it doesn't matter what the question is, because it's an evergreen answer for politicians over the years. And sometimes it's the right answer. Organised crime, murder, public order, cyber crime, burglaries. Yes, sure, we need to resource our guards. But drugs policy and tackling people with problematic and addiction, more guards is not the answer. And we, with this motion led by Éireann Éireann, are trying to move this conversation along with others, as Éireann has said, to build a tribe, to build a group that is going to push this towards where it needs to be as a health-led approach for harm reduction and recovery. Because the justice-led, the guard-led approach is failed and is failing. The statistics are there to prove it. 70% of all drug cases before our courts are for the personal use of drugs. And how many times have we as politicians, particularly over the last couple of years, discussed the log jams in our court services and all these things that need to go through our courts, when 70% of the drug cases are for personal use. But beyond that, this is about dignity. It's providing dignity to the individual, to the person who's suffering, to the person who is in need. And yesterday I was driving in here, it was about 9:30, 9:40, and I was stuck in traffic in the city. And my eye was taken over to a Garda car that was pulled over to the side of the street. One guard was in the car, the other was out searching an individual. Now, I don't know the backstory or anything like this, but I would make a judgment call based on what I saw, that individual had problematic drug use. What I saw, with my mind being prepared for this debate today, spoke to one thing. It was the indignity with which that young man was being treated. He was being searched. He was being patted down, arms. He had no bags, nothing with him. He was wearing a tracksuit. And when it got down to the midsection of this young man, the guard pulled the trousers down of this young man down to his knees to search in around his boxer shorts area. It was on a busy street, in massive traffic, in full view of me and I don't know how many others. Traffic moved on, I moved on, I don't know what the outcome was. But I know one thing, that individual was not best served by what happened to him on that side of that busy road in our city yesterday morning, and that is happening thousands and thousands of times. Nothing was done, nothing is being done to assist that individual in terms of that interaction yesterday. All was being done to that individual was stripping them of their dignity, criminalising them. Now, and unless we get this conversation right, unless we build on this and move on this, an awful lot of people will have looked at that yesterday and will have probably gone, good enough for him. You know, that's how we need to tackle it. We need to get more guards. That's why we need a tribe. That's why we need to move this on. That's why we need the health-led approach. That's why we need the resources. We need the facilities. All the evidence are there. We do not have to build the evidence. We have the models that's been successful. We have the Portuguese model. We know it's failed. We don't need any more primetime documentaries on this. We just need to listen to the people on the front line, and we need to go within our own selves and say, how do we want our own fellow citizens to be treated, our family, our friends, because there but go the grace of God. That could be my son, my brother, my best friend. That could be them. Because drug addiction can hit anyone, and it can strip away everything in your life and leave you so vulnerable, so vulnerable. And we, as a society, are failing. We're failing on our drugs policy. We're failing communities. We're failing families. And we're failing the individuals that are at the front line. So please don't just dismiss this. Let's put energy into the Citizens' Assembly. Let's put resources into it. Let's change policy. Let's change it here. And there are people on all sides who support it. This will get cross-party support. Let's push it through. I commend Éireann for leading this on behalf of the Labour Party and look forward to working with people to bring this further. Thank you.
Thank you very much, Chair. I'm incredibly proud to be a member of a party that's drafted this motion and to call myself a comrade and a friend of Deputy Dáil Éireann, who has pioneered reform in this space. Now, it's beyond time that we woke up as a society and as lawmakers to the stark reality of drugs in our society, and we have to face the world as it is, not how we would like our ideal world to be. Because the world of today, the Ireland of 2020, we simply have to face the facts that by the law of averages, someone we care about, someone in our family or in our close friends group took illicit drugs last weekend. They may have taken them yesterday. They'll take them today. That's a reality. And in facing up to those facts, can we also admit that none of us would want to see them, the people we care about, have a criminal record for consuming something that is readily available on the streets of every town and village in the land? We have a problem, and it's not one that can be fixed with more Gardaí, with more prison cells, more prosecutions, more convictions. Drugs, addiction to drugs, is a health problem. And for us to admit that the so-called war on drugs has manifestly been a failure is okay. That's okay to admit that. We're spending more than ever on Gardaí and on resourcing the wider criminal justice system, yet drug use is rising. It's rising. Deaths caused by drugs are high, and the continuing threat of convictions associated with drug use hasn't prevented the use of cocaine rising by 10,000%. Think about that, 10,000% in 25 years. And as Deputy Howland intimated earlier on, when a policy isn't working, we have an obligation to change it. And to do otherwise is criminal. In fact, it's criminal neglect. Now, I represent an area where gangs fighting over the drugs trade have seen people shot dead, many more maimed and butchered, homes destroyed by arson attacks, kids traumatised, decent people I represent living in constant fear. Now, I've been at the forefront of crafting a multi-agency response to this crisis in my community, and I've also demanded a tough response against criminal gangs who make fortunes from the drugs trade. And thanks to our community and the Gardaí in the Drogheda area, we have had that tough response. And I make no apologies for demanding that we be tough on drug gangs and on smugglers. Now, gang crime may have been quelled in my own area, but drugs are still being dealt. Drugs are still being dealt, despite the valiant efforts of the Gardaí, and that's a reality with us everywhere. And there's no inconsistency in taking on the gangs and their ill-gotten gains and supporting that strategy, but at the same time wanting to see a sea change in our treatment of the sick, isolated and poor drug user who is at the end of that supply chain. Now, with all the money spent on so-called crackdowns, we will still see so many people needlessly dying. People I've known all my life have died because of heroin addiction. And we see and know too many people in our communities who are now nothing short of ghosts, occupying hollowed out sick bodies. People who are ill, they're just bereft of hope. They're wandering our streets, stigmatised and shunned. They have a health problem. If we met somebody on the street who was apparently having a heart attack, we would go and help. But somebody who is clearly sick because of their addiction to drugs and because of problem drug use, we shun them, we stigmatise them, we ignore them. And in so many cases, prosecution after prosecution just simply hasn't deterred them. We're locking up too many people whose real need is for a treatment bed, not a prison cell. Now, we pride ourselves in this country on being progressive, but in the case of drugs policy, we certainly aren't. Now, if we spent just 20% of the money we spend on the criminal justice side on intervention and treatment, agencies like the Red Door in Drogheda would not have to go cap in hand to the HSE every few months for short-term funds to retain critical social workers and outreach workers, positions that they in fact were provided with because of the crisis situation in my own town. Short-termism at its best. Services like this should simply be provided as a matter of course. They should be de rigueur. If we took the time to take an evidence-based, health and patient-led approach to the use of drugs. Now, can we, in conclusion, Minister, all of us in this society, Have that difficult, challenging conversation. A conversation we need to have, a democratic dialogue we need to have in a citizens' assembly format, and drop the exhausting moral outrage. That's what it is. It's exhausting, the moral outrage that we hear. And take that evidence-based approach and deal with the world as it is, not how we think it should be.
Kenny, you have 5 minutes.
To hear that. First of all, I want to commend Deputy Éireann and the Labour Party for bringing forward this motion. I think we can all agree that there is an exceptionally serious issue with drug use and its links to organised crime throughout Ireland. You have some people who will seek a numbness to whatever trauma they have in their mind, and quite often the only way that they can get this is through the use or misuse of drugs. I've read through some of the recent European drug report, which stated that Ireland has the EU's joint highest rate of drug-induced deaths among 16 to 64-year-olds. I think that's something that we certainly could not be proud of as a society. The report indicated that there is a growing use of crack cocaine throughout particularly the city of Dublin and indeed in many other areas as well. The National Drug Strategy has provided a deliverable pathway forward to secure people out of drug misuse, but government has failed to implement the policy and indeed failed to fund it properly. While you accept that the main thrust of this motion before us today is related to securing a timeline for a citizens' assembly on drug use, and that is something that is to be welcomed, but it cannot and should not be spoken about in a vacuum. We can see in our own communities every day people who have sought comfort from trauma in the use of often prescription drugs and indeed illicit drugs alike. As one of my colleagues said yesterday during the committee hearing, some people in addiction, it is the only way of a coping mechanism for them, because mental health services, unfortunately, simply aren't available for many people, and they turn to illicit drugs. The option, I suppose, has been considered and talked about for many years of the Portuguese model as a way forward is something I think that needs to be considered. And at the same time, we also recognise, and all of us recognise, the huge harm that the drug gangs have done throughout communities throughout the whole country, and the blight that they are on communities, and the terrible devastation there is. I have spoken to parents and grandparents who have been threatened for drug deaths for young people that have got into debt, and the trauma that is in their lives. The trauma it is as they look at a young person with hope and vision and ambition before them, just reduced to nothing because of their addiction to drugs. Someone described it once to me as suicide in slow motion. And I thought it was a very good example. And yet, if any of us met a suicidal person, we would immediately recognise the need to intervene, the need to do something for them. And yet, when people are addicts, very often there's all sorts of very difficult and I think wrong language used about them. I want to take this opportunity to outline our stance on the Citizens' Assembly. Sinn Féin is supportive of a Citizens' Assembly on drugs, and it's something that we have called for in the past. We have also supported the introduction of medicinal cannabis compassionate access programme because we want those patients who can safely benefit from cannabis-based treatments to do so. Our most recent alternative budget on addiction and recovery was pledged 45.2 million for service provision. This is over 10 times the total amount that government proposed to enhance the service of 4 million. Harm reduction and prevention has always been and will continue to be the principles for Sinn Féin in our development of future drug and alcohol strategies. Part of the harm reduction approach will be to tackle organised crime directly, and not the vulnerable foot soldiers, often addicts themselves, who are used by unscrupulous drug barons. Criminalising addicts is not the way to tackle organised crime, and I hope that the government, when they do introduce a timeline for the Citizens' Assembly, will take all these factors into account and recognise that at the end of the day, what we have to deal with here is a problem that, while it has a whole criminal element, and we accept that many people who are addicts can often be involved themselves to feed their habit in selling drugs and being involved in that, are sucked into that whole criminal underworld. We have to recognise that the first thing they are is an addict, and treat that first, and then deal with the rest of it. So I think, Minister, the proposal here to have a Citizens' Assembly is one of the best ways that we in Ireland has developed over the last probably decade or more to deal with complex and divisive issues, to bring experts in, to get the opinions of people who are at the coalface and who can deal with this issue. And hopefully we can come out of that with a solution which will serve well, not just for the general public, but also for the addicts and for future generations. Because I don't think we can continue this notion of a war on the supply side of drugs, and that's what it is. It's only on the supply side. We actually need a war on the demand side. We need to reduce demand, and we need to do that by having appropriate services in place for people who are vulnerable and people who could possibly in the future fall into the traps of the drug addiction which so many have in the past.
Deputy Tommy, go. You have 2.5 minutes.
Minister, I was listening to your speech there in describing what the government has done. To be honest, Minister, this government has been shocking in their treatment and support of people in recovery services, people in the coalface facing addiction. Deputy Kenny made a point in our budget that I put forward in our alternative budget. We put 45 million. And 45 million isn't going to solve everything, but it's a start, an ambitious start to support people, which I don't think this government is serious about. And I thank the Labour Party for bringing forward this, because I've advocated, like others in Sinn Féin, for the need for the Citizens' Assembly, because it is a complex issue, but it must be dealt with. And people, sometimes you have to face the hard questions, the unpopular questions. And can I say this, the Labour Party or anyone supports this, there's no votes in this. Because for some people, their attitude towards people in addiction can be very aggressive or very nasty. But these are human beings that we know personally. I know people who've died. I know families that have been destroyed. I know 2 people this year who were in the throes of addiction, who took their lives because their families were being threatened because of drug debts. They took 2 young men who hung themselves. So when we talk about, I had a speech written, but we have to do something, Minister. It needs to be, and this needs to be done now. It should be the first thing to happen early New Year, because there are people out there who need support. The number one issue in relation to why people are in addiction is poverty and trauma. No, listen, we can't prevent that. But what we can do is support the people who are on the ground, to support the people who are in the throes of addiction, and to support their family. And I know this personally. So, Minister, what we're saying is, will you please bring forward the Citizens' Assembly on drugs, and can we develop, and can this government please step up? The last point I would make, 12 years, task forces are waiting for their funding to be restored. If this government had any bit of sincerity about tackling drugs and helping those in addiction, that's the first thing you would do.
Thanks, Deputy. Deputy Chris Andrews.
Chair, I'd just like to commend Deputy Éireann for bringing this motion. It's a really, really important issue, and it affects every section of society. And we do need more discussions on how we approach the use of drugs in this country. We need to hear from absolutely everybody. Everybody has to have a voice on this, whether we agree with them or whether we disagree with them. We have to ensure that people are engaged in this discussion. And the best place for that, as has been said, is in the Citizens' Assembly. It's really important. It allows people to have a voice. It teases out all the complex issues. And we have to ensure, like I said, that nobody's point of view is considered invalid. So many families and individuals are directly affected by the failed approach the state has taken to drug use. We need to see a step change in how we approach drug use. We need to see a health-led approach that has harm reduction and prevention at its core, and not the criminalisation of those with addiction problems who need help and support. Someone who robs a bank is a criminal. Somebody who has an addiction is not a criminal. Somebody who smokes some weed occasionally is not a criminal. And we need to treat this as a health issue. Portugal did this, introduced this decriminalisation, and the sky didn't fall in. People's lives were saved because overdoses the level of overdoses were reduced. So this proposal is not radical. You know, we're not an outlier in terms of European policy. It's become an essential policy, a change of policy, and we have to adopt that. During COVID, we regularly heard we have to believe in the science. Now, the WHO, I understand, recommends decriminalisation, and we have to ensure that we now, equal to the issues around COVID, we have to ensure that drug decriminalisation is, and we believe the science around that particular issue. Chair.
Just trying to keep on time here. Deputy Maiden.
Thank you, Cathaoirleach. I would like to begin by thanking the Labour Party for bringing forward this motion. This is an area that has been neglected and left unchanged, unchallenged, tied in with restrictive punitive policies and compacted narrow legislation, with consequences leading to criminalisation, particularly of many young people, which in turn leads to life-changing disadvantages, such as denial to travel to certain countries, denial to employment in certain jobs, and sometimes resulting in the loss of supports from their communities and friends. The government are far behind the curve on this one, particularly when it comes to the use of medical or medicinal cannabis. The introduction in 2017 of the Medical Cannabis Compassionate Access Programme is very welcome. However, this noteworthy victory mostly belongs to Vera Toomey and her incredible fight for access to medical cannabis for her daughter Eva. In my humble opinion, without her brave and courageous stance against the system, which denied her child the access to medication that worked for her daughter, this programme would not have come about. To continue that struggle, we believe it is essential that this compassionate programme includes the widest possible range of medical conditions, including the relief of chronic pain. The other essential component in improving and facing up to societal changes for the better is the convening of a citizens' assembly on drugs. Sinn Féin are totally in agreement on this. We believe this should be held as quickly as possible, with a fixed enshrined date for its inauguration by the current government. One of the other issues I would like to raise is the treatment of dual diagnosis. The existing model of care in people with dual diagnosis is appalling, Minister. A person with a dual diagnosis is one person who is suffering substance abuse and a mental health issue. Many ask for the support for their addiction, only to be told to sort out their medical illness first. Many ask for mental health supports, only to be told to stop using substances, despite their lives being out of control, with that substance being the only support they feel they have in the whole world. Falling between mental health conditions, alcohol or drug addiction, they are shown a revolving door. Funding must be forthcoming. 4 million is totally inadequate. Programmes for drug and alcohol must be combined and client-centred. Finally, we would like to see a model something similar to the Portuguese system being examined within the context of Irish law. And once again, I will call on the Minister to initiate the setting up a Citizens' Assembly on drugs. I fully support this motion and I hope all the other Oireachtas members will do so.
Our next speaker is Deputy Paul Donnelly.
Can I thank Deputy Éireann for bringing forward this motion. I suppose this is such a huge topic that you'd need 2.5 hours, not 2.5 minutes to try and address some of the issues. But drug crisis is something that I have seen in my community that I grew up in the northeast inner city and the community that I moved to in Dublin West. In both communities, in some ways, there's a common denominator. They're working class, large pockets of disadvantage, of poverty, of unemployment, of early school leaving, and particularly decades of trauma. Mostly young working class people are criminalised, even though drug use is widespread amongst the entire population. And I think we can never underestimate the extent of drug use. And it's in every town, every village, every club, every bar, every sports club. Over 40 years since Ireland experienced its first wave of drugs back in the early 80s, it's worse than ever. Although heroin might be reduced, and the use of heroin and the impacts on heroin might be reduced, crack cocaine, I think, is the most dangerous drug that we have to face in the coming weeks. And I've just recently read a report from Ballymun in relation to it, which is utterly frightening. However, I do remain optimistic that we can turn the corner in terms of drug abuse and misuse, but we need to change the way it's tackled. First of all, we need to talk about funding, because funding is critical. The organisations that are on the ground need the funding that has been cut from them over the last 10 years or so. But if there's one transformational thing that we can do, and that's officially in law, recognising that people using drugs are not criminals and should not be criminalised. If we're genuinely to treat drug addiction as a health issue, then we need to provide the services to support people, not to jail them for possession of drugs. That serves no purpose whatsoever. If it served a purpose, it would have worked. And we can see that it has failed miserably. In terms of the injection centre, there are people who are not here today because that has not been delivered. There are hundreds of people. And I think we do need to deliver that as quickly as possible. And can I just commend every person who's out there on the front line in services fighting every single day, and the families who are standing with them and fighting against drug addiction. And we need to support them, and I think this is a timely motion in relation to how we do that.
Deputy Mark Ward.
And I want to thank Deputy Éireann and the Labour Party for bringing forward this motion. I also want to welcome Dáil Éireann into the gallery, a comrade of mine who has worked in addiction services like myself right across Dublin over the years. And in all those years, we've seen so many people fall through the cracks, Minister. The culture of drug use has changed. Years ago, people who had drug problems had a drug of choice. Poly-drug use is now the norm, and it's almost impossible to get a detox bed if you're a poly-drug user. The bar is set so high for treatment and recovery. Going cold turkey is not an option for somebody whose primary drug of choice would be benzodiazepines or alcohol, because to stop taking them straight away could be fatal. So we need to reimagine how treatment is offered to people. But any legislation must be matched by resource in our communities. If the law was changed tomorrow and we were sending people to treatment rather than prison, it would not work right now, because the resources and the services are just not there. Years of underinvestment by successive governments have seen to this. You cannot strategically plan if you're in a community drug project, because the resources do not allow. So we must put in the resources to allow our communities to respond. We also need to have an adult conversation around dual diagnosis. We need to have a no wrong door policy in place for people with dual diagnosis of addiction and mental health, Minister. When we're talking about decriminalisation, what is a crime is that the only public inpatient dual diagnosis facility in the state is closed for over 2 years. We have many discussions over this, Minister. Keltoy, I won't second guess our incoming Taoiseach's reshuffling of the cabinet, but if you're one of the reshuffles, Minister, as your parting shot, do the right thing and open up Keltoy as a matter of urgency, because that needs to happen. The Citizens' Assembly is something that we support fully. We also have to make sure that the youth voice is heard at the Citizens' Assembly. There was a consultation with the Department of Health to gather the views of young people recently, and they've asked to make sure that their views are heard at any Citizens' Assembly going forward. We must not lose the youth voice in this debate.
Thank you. And our final speaker, Deputy Patricia Ryan.
And I too want to thank Deputy Éireann and the Labour Party. Minister, over the last 25 years, almost 10 people each week in this state have died as a result of drug taking. Along with Sweden, Ireland now has the joint highest rate of drug-induced deaths among 16 to 64-year-olds in the European Union, and Deputy Kenny already mentioned that to you. The harmful effects of drug abuse, including crimes of violence, intimidation and extortion aimed at addicts and their families and their communities, used to be confined to the inner city and working class suburbs. Now the effect is felt in all our rural towns and villages. We in Sinn Féin believe that harm reduction and prevention should be the guiding principles in development of future drug and alcohol strategies. In our alternative budget, Minister, we pledged over 10 times the amount proposed by you in government, 45 million as opposed to a paltry 4 million. The current government's policies on drugs are not working. They are not working because your indifference, or worse, your negligence. The National Drug Strategy is a list of missed targets, despite the best efforts of the various agencies. Deputy Kenny also mentioned how we in Sinn Féin have called for a Citizens' Assembly to discuss this issue. We supported the introduction of the Medicinal Cannabis Compassionate Access Programme because we want those patients who can safely benefit from cannabis-based treatments to do so. We believe this programme must be reviewed and extended to include the widest appropriate range of medical conditions, including chronic pain. The number of people prosecuted for possession for personal use has increased almost five-fold, Minister, over the last 25 years. with more than 250,000 convictions in this category. We need to focus on treating addiction as a healthcare issue first. We need to treat the root causes of drug abuse. And I'll finish with this. It is no accident that the effects are deeper felt in working class areas, Minister, that are suffering from years of government neglect, where there is little to occupy idle hands, where the rate of completing the Leaving Cert drops significantly. Never mind getting inside the door of a third-level education. Lack of education consists of a vicious circle of prison, where the stigma of prison leads to difficulties securing employment and leads to more prison time as a result. We need to break the cycle of intergenerational incarceration. We need to support those in prison to free themselves from addiction, to educate themselves, Minister, so they can remain free from both prison and addiction. Thank you.
Deputy. Moving on now to Social Democrats. Deputy Gary Gannon, you have 8 minutes.
It's often said, and before I start, I want to thank Éireann and the Labour Party for bringing forward the motion. I think it's hugely important, and I'm delighted we get the opportunity to speak about it. It's often said, and it's been said several times today here in the Chamber, that the war on drugs has failed. And I think all of us with good intention would see ostensibly a war on drugs failing insofar as it hasn't done anything to alleviate the suffering of the communities that have experienced it. But then I think of a Latin phrase, cui bono, which is loosely translates as who benefits. And then I ask myself, who actually benefits from the so-called war on drugs that was initiated by Ronald Reagan in the 80s? It certainly isn't the communities that I grew up in and represent in the north inner city. It isn't the communities destroyed across Ireland, UK, America from this war on drugs. But I tell you who has actually benefited from the war on drugs. The legal profession has benefited from the war on drugs. If you think about a young fella who grew up in my constituency, for example, or somebody who's suffering from a drug addiction, who's been arrested several times for the consumption of something that ostensibly they're taking to deal with trauma, addiction, pain, the amount of people who are imprisoned for heroin, for crack cocaine, for example. If you think about what they have in their possession when they're arrested, once, twice, 3 times, usually no more than a couple of €100 worth of that drug. And then that drug starts to become monetised, and their poverty and their suffering and their pain starts to become monetised. So they get brought to the courts, their solicitor gets paid, a judge gets paid, a barrister gets paid. They get brought to prison, and that couple of €100 all of a sudden becomes the 82,000 plus that it costs to incarcerate a person in this country. And then in prison, they'll actually probably receive the treatment that they should have got beforehand, but then that costs money, the doctors cost money. All of a sudden, that couple of €100 that that person had in their possession to deal with their trauma, their suffering, their pain, all of a sudden, that couple of hundred has been magnified into the hundreds of thousands for a class of people that is not reflective of the community in which that person came from. So I sometimes ask myself, has the war on drugs actually failed? Or has it done what neoliberalism always does? Monetises poverty, monetises pain, and continues to do that for the last 4 to 5 decades, and will continue to do it unless we actually call insanity, and point to the very reason why we probably have to fight so hard just to enact what is essentially medical best practice when it comes to the decriminalisation of drugs. The reason why we haven't done it yet is because there are a class of people who benefit from it, and it's not the class of people that is being discussed today. And until we establish that, well then, we're not going to combat this. So let's just call it out for what it is. There is no war on drugs. There's a war on poverty, and not in the way that we imagine it should be done. There's a war on the continuation of it, because people benefit from it, and it's not those who suffer from it. And I think we have to call that out. When we think about models which do work, we hear a lot about the Portuguese model. And Minister, I know you're coming up to your midterm of your role in terms of drug minister. Minister, I would love for you to give me an analysis of whether you feel that the model that we have in this country, which I know we often talk about it being a healthcare-led, and we can't have a healthcare-led while still criminalising people at a base level. So I'd be interested when you kind of reflect on your role, whether it changes or not, if you could tell us if you think the Portuguese model, for example, has its flaws. Of course it does, everything has its flaws. But whether it's a better model than ours, and what are your measurements for success in that regard? So the Portuguese model we know has a lower level of convictions now. It has a higher level of taking people in the throes of addiction and bringing them out of that pain and into recovery. It has a lower level of young people getting involved in addiction at that level, as a lower level of people with offences. So I'm fascinated as to, and I think I already know the answer, why haven't we done it? Why do we need a citizen? And I support the Citizens' Assembly, of course I do, as does everyone else in this chamber. But in 2023, hopefully, we're going to get a lot of experts around the table with citizens of this country, and they're going to tell us what there's probably a decades-old body of evidence that says criminalising people for addiction doesn't work. That will be true in 2023. It was true in 1993, and the evidence was there. And yet we still haven't done it. And I don't hear, despite the fact that we talk about kind of our centre-right parties of Fine Gael and Fianna Fáil tell us that they're more progressive now in their outlook. And we also hear about kind of being led by expert-led medical best practice. But yet you'll still stand here today and say we're not going to oppose this motion brought forward by Deputy Reardon, the Labour Party, and supported by all of us. But you're not going to do anything about it. So next year, despite the fact that this is going to pass, in communities all over this country now, in laneways, we'll still have people either injecting themselves with a poison to deal with a trauma or taking crack cocaine for the very same reason. They're going to be looking over their shoulders because a Gardaí who's going to be sent away from kind of essential commercial addictions or away from actually addressing burglaries or anything else, they're going to be sent down those laneways to catch a person, to incarcerate them, to put them through the process to generate huge amounts of money for people that don't actually live in the communities they suffer from, because we don't actually just do not only what's right, but what's medically and scientifically proven. And then the hypocrisy of it. I absolutely rolled my eyes to the back of my head when I heard a politician say, oh yeah, I smoked a joint in college, not great. And we tap them on the back and we put them on the front of magazines and we say, look how cool that politician is who said he smoked a joint in college. Because you know what? He's safe and he's protected because he comes from a class of people who are protected from the same criminalising that would happen to if a person in the north inner city put their hands up and said, I took drugs when I was younger. They'd be considered to be a criminal. But a politician or someone like trying to get themselves some credit, and some other middle class profession will say, oh, of course we all did it in college. Yeah, but you weren't criminalised for it. You didn't have a lifelong conviction. It didn't impact the type of job you might get in your future. The hypocrisy of it is scandalous. I mean, I say here, and I want to talk about a compassion-led approach to drug addiction. But first, take the hypocrisy away from it. Call it for what it is. It generates massive revenue for people who aren't in these communities. And yet we'll stand here and we'll say, we'll pass this motion, and you'll do nothing. It's absolute scandalous. And then if we do have a rejig of ministries, we'll probably have another minister comes in and does nothing as well. And we'll patronise the communities by saying, oh yeah, we've invested this much money into communities. What's the outcome? You've invested money into communities. I guarantee you it's not going to generate the same amount of money as the money you're going to invest in middle-class communities who will benefit from it through their work in the legal professions or everywhere else. Because you know what? Poverty pays, but it doesn't pay the people that suffer from it. It pays other people. It makes meal tickets. And we know that. The communities know that. The people who are impacted know it. Minister, Fine Gael, Fianna Fáil ministers know it too. The legal profession knows it. Until we call truth on this, the war on drugs is actually just as a war on poverty. We'll all say the war on drugs has failed, hasn't, succeeded, made wealth out of it, monetised it, monetised poverty. And until we call that truth for what it is, we're just lying to ourselves, patronising communities. We're saying, oh, we've invested this much in. You haven't. You've sustained the problem. Just sustained it, generated it, and let that income keep flowing into the kind of more middle-class communities that actually benefit from the suffering and the trauma of other people. And it's absolutely scandalous. Thank you.
Deputy, moving on to the PPP swap. Deputy Jean O'Kenny, are you sharing, or is it just yourself? Yeah, well,
a few turns up. Thanks, Caoirleach, and I'd like to welcome this motion and the good work of Deputy O'Riordan in relation to this. I think it's a good track record in relation to, dealing with the issues around drug reform, and obviously that's very, very welcome. And reading the motion is kind of, you don't have to, cry in despair or put your head back up and keep pushing for reform in relation to this issue, because it's a damning indictment of successive governments that this was allowed to happen and continues to happen. And it's extremely kind of somber when, that 10,000 people over the last 25 years have died of drug-related deaths. And these were all, at one stage, brothers and sisters, mas and das, friends, family, of everybody. And, addiction is very complicated. and it can be messy, to say the least. But I'm sure lots of them people could be still alive if it wasn't for a different policy. I'm sure of that. I have friends that would definitely be alive today if it wasn't for marginalisation, social deprivation. But when you throw the depths of despair around addiction, it's one way to hell. And that's what communities have suffered, families, individuals. And I'm sure, Minister, these people that have succumbed to addiction, some of them could be still alive today if there was a different policy. I'm 100% certain of that. And if you look at different jurisdictions around the world, particularly Portugal, people are saved. If you can save one life, literally one life, that's worth it. It's worth changing the laws if you can save one life. And that's what it's worth fighting for. Minister, I know this government have paid a lot of lip service in relation to a health-led approach. And obviously that I suppose, the terminology is welcome, but does it actually counter the situations where people find themselves in, where they're criminalised, people are brought through the criminal justice system and people are marginalised? It simply doesn't work. And, the evidence points that we need a different narrative around that. I mean, the proliferation of drugs since the 70s has incrementally increased. The availability of drugs has incrementally increased. Not only Ireland, across the world. It's worth hundreds of billions of dollars per year in relation to the demand. But the laws that we have at the moment, which emanate from 42 years ago, are not a deterrent for people to take drugs or people to supply drugs. Over 80% of the people that are in our prisons at the moment are there for drug-related crime, wherever, from the whole pyramid, from the very top to the very, very bottom. Now, does not say to you that the present laws do not work. And we need to do something different. And that difference is, obviously we can talk about health-led approach, harm reduction and all that, but we need to change, attitudes in this country have changed. They've changed dramatically. You just look at what's happened the last 10, 15 years in relation to a woman's right to choose, same-sex marriage. All that has changed. So social advancements have moved on in Ireland. But sometimes this place hasn't moved on, People's attitudes now, I think, to drug reform have changed. They do not see criminalising people for personal drug use literally legitimate anymore. So there has to be something very, very different. And I believe this institution is way behind the public opinion in relation to this issue. And I think the days of prohibition and the days of the Misuse of Drugs Act, which were, as I said, 42 years old, are coming to an end. We have to do something very, very different. That's starting from changing the laws around drug use. And Minister, I don't know if you're going to be in this position in 6 weeks' time. Obviously, and you might have another a new minister. We don't know. But it emanates from political choice. Why has successive governments continued to allow this to happen? It's largely been Fine Gael and Fianna Fáil, right? Yeah, that's the question that I always ask myself in relation to, what's in this motion. Why has this been allowed to happen? There's vested interests and so forth. But at the end of the day, there is no political will or no political courage to change what's happening. Because what's happening, it's working class communities. If all these people, I guarantee you, the vast majority of people who have died are from certain postal codes in Dublin and different parts of Ireland. They're largely working class people, right? If this was different, if this was in a different postal code of Dublin, it'd be a different response. Completely different response. Completely different response. That's why I think you need political will, because if you don't have political will, people don't have a voice. And the people that have succumbed to all this horribleness around addiction have been let down by successive governments and lack of political will. But that can be changed. That can be changed, and it can be changed in here. We need political will from yous, from the government, to say, look, this can't continue anymore. We have to do something very, very different. Look at other countries. They're changing the models around drug reform. They've seen in 10 decades of absolute things that don't work. They have to change, and countries in Europe are changing. Countries in the United States, Canada, and Asia, and even South America, which has been, terribly affected by the kind of drug wars, are changing their policies. They've realised that the present status quo doesn't work, because as long as the status quo goes on, people will be criminalised, people will die. But now, why allow that to happen? Because the people that have really kind of, I suppose, have been enriched by this, as a tiny, tiny percentage of people that have enriched themselves through masses of profits of money, and that what comes with that is grotesque violence that is subjugated against communities. So we need to do something, Minister. We need to do something. I really do believe the days of the Misuse of Drugs Act are coming to an end. It may take another couple of years, and we'll look upon the last 4 or 5 decades as a failure, like an absolute failure. And generations will say, look, at least this generation that exists today done something about the madness that has happened in the last 4 decades. Thank you.
Deputy, now moving on to the regional group, we have 2 deputies sharing, Deputy Cannon and Deputy Shanahan, 4 minutes each.
Very much, Cathaoirleach, and I welcome the opportunity, and I want to thank the Labour Party for bringing forward this motion. I think since I was first elected to the Dáil, this is the first time I've actually got an opportunity to speak about drugs and the plight of people who are creating an addiction. And I would say, Minister, there's 2 parts to this. There are the victims, who are the big part of it. There are the victims, the young people and the old, who have succumbed to the use of drugs and have been caught up in the whole addiction, and that is terrible. And you take families who have a son or a daughter or a brother or sister who has actually developed an addiction, whether it be drink or drugs, it creates devastation within a family and within the network of the family. Oftentimes it can be the fact that there's a helplessness in trying to deal with it, a helplessness in how to advise, because it is very complicated, as other deputies have said. I think that it's important that we state that addiction, drug addiction, is a killer and is killing people in this country. But what's more worrying is that it's becoming more common in modern times. I remember when my own family were going to secondary school, they could tell me who was dealing in drugs in the school, who was actually taking drugs, and all of this. They had that knowledge. So I think, thanks be to God, they never got involved in that, or neither did any of my family, thank God. But I would say to you that there is that prevalence of drugs every place in this country now. Be it in a rural parish where I live, or be it in a town or a city. It's not confined to the big cities. It's not confined. It's actually widespread. And there's a kind of a general acceptability that this can happen and it's right. And then we talk about the villains, and the villains are the people, the drug lords, and the people who are selling drugs and who are manipulating the minds of people who are addicted in order to make profit. There's something wrong when somebody can tell me, a young person can tell me who actually is dealing in drugs today in Tuam or whatever. They can tell me how it's been done and where it's been done. And there's a frustration that the policing of all of this seems to be helpless in trying to bring these people to court. I know that they're always trying to target the supplier, but I do believe that there are a lot of people who are making a lot of money out of the pain and misery of people, and I wonder why. And the fact that we have a lot of people in jail at the moment, as Deputy Kenny talked about, 80%, I think he said, of people who are in jail, it's related to drugs. But I guess the majority of them could be the victims as opposed to be the people who had profit from it. So it's important that we actually look at how we're doing things. And if, when you look back at the last 4 years, 5 years, I think there's been a huge increase in drug taking. I think we need to increase our youth residential centres because we do not have enough of them in the country. I think there's a lack of dual diagnosis and a refusal to dual diagnosis, and you might have people who have depression or other illnesses and they take to drugs as a solace. I also believe that the sale of drugs is now being done openly in our streets, in our towns, in our villages, and there's something wrong with that. And Minister, I think it is important that even when you think about it, that there's babies being born today who have an addiction from drugs or alcohol because of their parents' addiction. And I think we have a huge problem, and it'll take a lot to resolve it, and I think we need to get going with it at this stage. Thank you.
Good morning, Chair. I'm happy to contribute to this motion from the Labour Party today on decriminalisation and drugs policy that they're proposing. Minister, we've been speaking about a drugs crisis and drug abuse in our society for many decades now. And it's funny we use the word crisis, which suggests something is short-term, when the problem has been going on actually for decades, as well we know. And it has having a terribly destructive and a detrimental effect on all parts of our society. And I suppose largely it's thought about that it's confined to the poorer communities and the disadvantaged, when in actual fact it is spread right across society now. But certainly those who are most vulnerable seem to pay the highest price socially and economically. I think we can see the fallout of drug abuse and drug addiction. And in our own city here, we don't have to walk too far from this chamber to see it in its physical form. But as other deputies have highlighted, it is right across our country now. And drug abuse and drug dealing is endemic in our society now, sad to say. And unfortunately, it's very hard to know what is driving that per se, because in a lot of cases, it is in very affluent parts of our society as well. But certainly for those who feel the sharp end of the drugs culture, it robs them of any future, and it robs their families of any bright future for their children. And it has to be said, it is driven largely by greed. And we have the ignominy in Ireland of having two of the largest drug dealing gangs in the world operating from bases in Spain, but also who have significant ties to Ireland. And we have a two-tiered drug society here, in my opinion, as well. We have one group who are recreational users, think of themselves as recreational users of cannabis and cocaine, and they see themselves as snorting cocaine but not being part of the drugs industry, while yet they look at those who are injecting drugs as somehow being a major part of the problem. But unfortunately, everything is part of the problem, because it is dealing to this absolute conflagration of drugs in our society. And it is rampaging across our society. And if you speak at the moment to psychologists and psychiatrists, they will tell you the problems that they are seeing from cannabis use, particularly in youth, and where paranoia and extreme psychosis is becoming a problem for young teenagers who are just dabbling in cannabis alone, and yet cannabis is not considered by many to be a gateway drug. So we have a significant amount of work to do in terms of our drugs policy in this country, Minister, and I think the Citizens' Assembly has to happen as a matter of urgency. We need to get a better defined public opinion as to what the problems are and what our population thinks that the government and the state can do in terms of adequate responses. But absolutely criminalising people for very small amounts of drug possession seems a retrograde step, but we must do something in terms of education. And for anybody who spends any time watching television, there's a programme on Netflix at the moment which shows the fallout of drug abuse right across the northeastern United States, particularly Hyannisport and Cape Cod. And one of the things that's absolutely stark within that is the affluence of families, and families who are engaged in sport and high achievers, and how they started dabbling in drugs, particularly cannabis at the early stage, and ultimately ended up at the far end of opioids. And that is because if you're dealing with drug dealers, they will present you with many options, and people who are dabbling in drugs will ultimately try one thing to another. So we need, first and foremost, in my opinion, Minister, far better education, and we need far better teeth in terms of the judicial system going after the high-level dealers and the importers of hard drugs.
Thanks, Deputy. Moving on now to the Rural Independent Group. Deputy Collins, you 4 minutes.
Thank you very much, Chairperson. Glad to get the opportunity to speak on this motion here today. It's titled Drugs Policy Decriminalisation of the User. I suppose I've heard different speakers here today talking about people taking drugs and the amount of deaths that there has been out there, and that they feel if it was legalised as such that this wouldn't happen. It's hard to figure that one out in my own mind, because a lot of the cities, and I was down in the centre of Dublin City recently, which is a rare thing because usually we're up here by day, but I was down by night, and it was shocking to see what was going on side streets and whatever in our own capital. Shocking, absolutely shocking. I'm not a person to have much fear, but I can tell you I was looking over behind my shoulder continuously. If you legalise it, is that going to get better? I have my doubts somehow. And I do kind of drift back though to medicinal cannabis, and I do think it's an important subject to raise here in the Dáil, and the difficulties. And I think everybody knew the story of Vera Twomey. And in fairness, I worked very close with Vera Twomey to get medicinal cannabis for her daughter, as did, in fairness, our Rural Independent Group. But I'd say one other TD that really put his neck on the line was Gino Kinney. That worked very, very hard to make sure that child got the medicinal cannabis oil that she needed. The difficulty that mother had to go to just get something legalised that would help her child was shocking, to say the least. We're talking about making the drugs more, I suppose, acceptable in law, but we were fighting that time, and that's not long ago, to make it simplified for a mother to save her child's life. And how many more people out there with multiple sclerosis, with all different ailments that need medicinal cannabis, are finding it very, very difficult to access that. That's the legal side of it, the medicinal cannabis. Okay, Vera won the battle for Eva, and I'd like to wish Eva a very happy birthday. She's 13 years of age, 4 days ago on the 26th of November. But that battle led to blood, sweat and tears for her mother. And for any woman to have gone through the Trojan effort she made for her daughter, yes, but also for others, is something that should never be forgotten in this state. And I very seldom I get a chance to read a book, but I would advise anybody that's on about medicinal cannabis or anything else to read For Eva, the book that was compiled by her mother, and a mother's fight, and obviously the father too, Paul, to save their daughter's life. As I said, somebody said here that, they were on about smoking joints, and people come in here maybe opposing something like this, and they tell, oh, sure, we used to smoke a joint. Sometimes I find it difficult because I never smoked a joint in my life. I never felt I needed to do that. I used to have great fun when we used to be hitting the streets on go with a few drinks, a few pints, and, innocent fun. It seems to be now we're taking it each level, and we're accepting a new level and a new level and heightening the levels. So, okay, we'll accept alcohol, we'll accept drugs, some certain drug use, we'll accept. Where are we going to stop? That's what I'd like to know. Where is this going to stop? And is this going to add extra pressure to an already over-pressurised system? I did have a gentleman that came into my clinic recently in Skibbereen, was very stressed that he had been caught with, growing his own drug for his own use. He was very strong about it, that I should air that view here in the Dáil, that at least he wasn't supplying it in the locality. But, there's the laws of the lands are there, and there's much I can do when the laws are the way they are. But I certainly would advise people, to, as I said, to look at the Vera Twomey story. It's more interesting than any other part.
Today, and I'm not sure really set up a citizens' assembly seems to be a fanciful thing now to do for every issue. I don't believe there's plenty of evidence, and sadly the situation with drug use and abuse is just shocking in our country, and we all know it. And Deputy Collins mentioned the O'Connell Street in Dublin. I can go to my own towns, in my own constituency, our own villages. They're there. And nothing has been done to tackle the suppliers, to tackle the so-called gangs that are looked up to. And they manipulate and use and destroy young people and destroy their lives and their families. And we see they're glamorized and glorified in ways. And we see the proliferation of that right throughout the country. We must deal with that. We also must deal with, I suppose, all drugs, alcohol, everything else, and the overuse of all. And many of us, myself included, can overindulge. So we have to look at ourselves and our own practices and what we're giving to people as well. But as regards the Gardaí and seizures, 34 million worth of drugs were seized in the first 9 months of this year. 34 million worth. And that's only the tip of the iceberg, I believe, as to what's coming through. And the lucrativeness of the business, the murky business as it is, and the fact that the judicial system doesn't seem to be able to cope. Where the Gardaí do sterling work and bring people before the courts, like in many areas, the judicial system hasn't caught up, is way behind. It's decades, if not a century behind what it should be in many areas. So I'm not saying lock them up and throw away the keys. Again, support, drug support workers, but for the likes of Seesaw in Clonmel and Tipperary Town and voluntary organisations and some private counselling, there's no supports. I raised recently huge issues of drug sale and drug use in O'Connell Street in Clonmel and the streets off within the lanes and the car parks, and intimidation of ordinary shoppers and lack of Gardaí. Like in Tipperary Division, we're so short of Gardaí, and the drugs sectioned in, the drug squad is reduced. For a time in the Clonmel district, we didn't have anyone in the drug squad, and now we have one or two that do good work, but we just don't have enough, and they don't have the supports. And then when they go to the revolving doors of the courts hearings, they meet them back out in the streets on continued bail and continued free legal aid. So we have to wake up and smell the coffee here. So we need to support them. As I said, the HSE are sadly lacking. There's positions vacant all over South Tipperary in our area, and some in North Tip, who haven't been filled for years. And we can apply managers, we can apply anybody we like, but these so badly needed and dedicated personnel that will help with families, and I support all the volunteer groups that try and help, and some ordinary individuals that get involved and try and help. I want to salute Deputy Collins as well and the effort he made for Vera, with Vera Toomey and our group, assisted the best we could, and to wish Eva a happy birthday as well. But look, the battle that she went through for her medicinal purposes, and how the minister had to be dry kicking and screaming, and then they had to get her from abroad and had to be signed off by 2 consultants. It's so difficult and so arduous. But Minister, I think you were in Clonmel yesterday launching some strategy. You know, when it's a Dáil sitting day, it's not easy being in the constituency. We're elected to be here to do legislation. So an awful lot needs to be done here. And it's not a citizens' assembly. I don't think another talking shop is going to sort it out. We need dedicated action. But all the pious platitudes in the world, and even legislation, if we happen to Gardaí, if we happen to support agencies, to support people that may be slipping into that pattern and need assistance, and if we happen to the councils there to help them and help their families as well. So it's passing legislation here and changing legislation if we don't have the resources to help people. Thank you.
I would like to thank the Labour Party for bringing this private member's motion. And I think it's the start of a conversation. I think it has to go much deeper than what is being discussed in the private member's motion. Just in relation, and I'll explain that now in a few moments, I want a commitment of the Minister that the Citizens' Assembly on Drugs will take place next year in the first quarter. And if that's necessary, if that's the case, a motion needs to come before the Oireachtas to formally set up the Citizens' Assembly in early January, so then that will allow the movement of the Citizens' Assembly to move forward, and hopefully we could see the start of that Citizens' Assembly in March and April of next year. If and when the Citizens' Assembly set up, we know that people in all walks of life use drugs and can be affected by addiction, but the evidence is clear on the strong persistent link between serious drug problems and poverty. So there's a need to frame our discussions on drug policy in the context of a broader response to addressing poverty, inequality and marginalisation, and to providing the resources in our communities to do this. Evidence tells us that making someone a criminal for using drugs brings no benefits, causes significant harm, and results in stigma and discrimination. So there's a need to consider whether the current legal framework under which substances are prohibited and people using drugs are criminalised as working for our communities or as causing further harm. And I think when we set up the Citizens' Assembly on drugs, we need a commitment to include the voices of people who have been most impacted by the drugs problem. It's absolutely crucial. And I'm just going to read synopsis from Youth Workers Against Prohibition, and I think this is where conversation we have to go. At present, youth workers are responding to over 380,000 young people in communities across the country. We see firsthand on a daily basis the untold damage that criminalising young people has on their life opportunities in Ireland. We fully support decriminalisation, but we feel it doesn't go far enough to tackle the issue we see. Decriminalisation of all drug possession and cultivation for personal use is an important first step, but will still lead to the supply of drugs in the control of criminal gangs, and young people will still be at risk using unknown, unregulated substances. The time has come to have an adult conversation about the need to regulate all drugs, not just caffeine, alcohol and tobacco, and to create a model that keeps our young people in Ireland safe. Under the current policy of prohibition, the drug market is run by criminal gangs who operate through fear, intimidation and the exploitation of youth. Under prohibition, there is and always will be a thriving, unregulated drug market, and the longer we continue to hold onto the illusion of beating it, the longer we will have to see young people, families and communities suffer the consequences.
Thanks very much.
Thank you.
I'd like to thank Deputy Éireann and the Labour Party for bringing forward a motion. It's very refreshing for me that my erstwhile colleagues bring forward a motion that I can agree with so wholeheartedly. With one possible reservation, and that's the reference to the Citizens' Assembly, because it seems that there's an unusual degree of agreement in this chamber. The government are bringing forward no counter-motion, I understand it. So why can't we just deal with the issue? Why do we have to have a Citizens' Assembly to prompt us to deal with every single difficult issue, when we are essentially an assembly of citizens elected on behalf of citizens for a finite period of time to represent them? Can we just deal with this issue? I don't think anybody would disagree with that. There might be disagreement as to how we deal with it, but it is something that we need to deal with. I had the benefit of studying law in UCC, and I was taught by jurisprudence by Tim Murphy. He was, I think, an excellent lecturer there. He concentrated very much in contemporary schools of jurisprudence, and from that perspective wrote a very short book that was published the year I left UCC, so I've obviously read it, and it informed my thinking very much from then on. It was called Rethinking the War on Drugs in Ireland, published in 1996. Now, in 1996, Ireland was a different world. As Deputy Donnelly talked about, inner city communities were being ravaged by drugs, but it was pretty much contained in inner cities. Okay, the Henry scene, the party scene was going in Cork, and middle-class students were taking drugs. They weren't being stigmatised in the way that people in poorer communities were. But drugs were beginning to move out into the broader community. Since then, I've seen many successes of the war on drugs. The Collopys, the McCarthy-Dundons, they were just learning their trade in the streets of Limerick at that time. They went on to become major drug dealers, and the Gardaí did take them on, did put them away. George, the Penguin Mitchell was jailed. John Gilligan was jailed. The Kinahans are now on the run. So has that led to the war on drugs being won? Are there no more drugs in our streets? No, there are far more drugs in our streets. And they're in every community in Ireland. They're in every village in Ireland now. Bodyke, Scariff, every town, every village in Ireland now has a thriving drugs trade. And combating, wasting Garda resources, chasing these people, and they are evil. And a trade is very much in their hands. They're making money out of it. But the answer is not to continue to chase, and the answer is to take the trade out of their hands, to legalise, and to deal with the fact that there's a huge and growing market for drugs. And that's a health issue, and that needs to be dealt with in the same way that we deal with the appetite and the demand for every other substance, cigarettes, alcohol, etc. Instead of fighting a losing war, which is very clearly losing despite the best efforts of the Gardaí. So I commend Deputy Éireann, I commend the motion, but I'd like to see action in the House.
I want to firstly thank Deputy Collins and my constituency colleague Deputy McNamara for both sharing time so that I could speak on this very important issue. I want to also commend the Labour Party on using their PMB slot for this motion and chalk to Gino Kenny on the introduction of his bill last week. They're all positive legislation on this important issue and crucially creating the space for these discussions to take place in this House. I speak today as a representative of the people of Clare, but also as a mother, a sister, a daughter, and as someone whose partner has been impacted by this issue. I know firsthand the negative consequences of criminalising, the lasting effects, the anxiety, the shame, the fear and the isolation that comes with it, not to mention the stigma. We know that the number of people prosecuted for possession for personal use has increased over the past 25 years by 484%, with more than 250,000 convictions. Criminalising simply has not worked. End of. There is the social cost of reliance on punitive measures that do not deter drug use. It drains services that could be invested in evidence-based services, and it ultimately has, in some cases, forced these users into the prison service, which we know for many years now is a school of criminality. Behind the user, there is more to the story. There may be health issues, there may be trauma, mental health issues, and abuse. Criminalising do not address these issues. I want to briefly refer to the MCAP, which when introduced was a positive move, but is far too restrictive, especially when compared to other high-income countries. And there are thousands of people still on this island suffering with chronic pain, for example, that cannot get access. Instead, they are being criminalised. Ireland now has the joint highest rate of drug-induced deaths among 16 to 64-year-olds in the European Union. Meanwhile, countries around the world are increasing decriminalising drug possession. Portugal led the way, as we know, and 20 years on, we now have 31 countries that have decriminalised drug possession for personal use in some way, so Ireland would not be an outlier. I want to finish my contribution by just stating that we do need the immediate establishment of the Citizens' Assembly on Drugs and a commitment for it to commence its work in January. Gurmagat.
Thanks, Deputy. Moving on now to Minister Fleming.
Here, look, and I would like to thank members of the House for their contributions to this discussion on drugs policy, and I acknowledge their interest and commitment on this issue, and I want to thank the Labour Party for providing the time for this debate here today. The Government is fully committed to a health-led approach to the drugs issue and believes that people with problematic drug and alcohol use issues should be treated with compassion and care. As you will be aware, the programme for government includes a commitment to convene a Citizens' Assembly to consider matters relating to drug use. The government is committed to establishing the Citizens' Assembly on drug use, along with a Citizens' Assembly on the future of education at the earliest opportunity in 2023, following the completion of the Assembly's currently workload that they're engaged in at the moment. The timelines in terms of reference for the next assemblies will ultimately be a matter for the Oireachtas to agree on. It is anticipated the Government will consider the matter early in the new year, following which motions will be put before Dáil Éireann and Shannon Éireann for debate, setting out timelines and terms of reference for the new assemblies. The Department of Health has commenced preparation for the Citizens' Assembly on drug use. Discussions regarding the Assembly have been put in place at the National Oversight Committee for National Drugs Strategy. The Government is very positive about the potential contribution of the Citizens' Assembly to the Government's health-led response to drug use. Drug use affects all members of society, whether directly or indirectly, and imposes very significant social and financial costs. Involving citizens in decision-making on drug policy is therefore appropriate. There are two issues in particular the Citizens' Assembly on drugs use could consider. Firstly, how to better meet the diverse health needs of people who use drugs, and secondly, how to prevent the harmful impact of drugs on children, families and communities. It would also be very beneficial to have an international component to the Citizens' Assembly, so that there is an exchange of good practices from the British Ireland Council work sector on drugs and the EU drug strategy and action plan, especially with regard to alternative approaches to coercive sanctions. The voices and perspectives of young people on issues regarding drugs policy should also inform the deliberations of the Citizens' Assembly on drug use. Officials from the Department of Health are engaged with the Department of Children, equality, disability, integration and youth to undertake a consultation with young people on this issue. The Government is committed to pursuing a health-led approach for people in possession of drugs for personal use through the Health Diversion Programme. The programme will divert people caught in possession of drugs for personal use away from the criminal justice system and connect them with the health services. The health services will provide assessment and onward referral as necessary to provide a pathway to recovery and allow participants to avoid criminal conviction, which can have far-reaching consequences, particularly for younger people. This health-led approach is not only reflected in the rollout of the Health Diversion Programme, but is also in other alternatives to coercive sanctions which are currently in place, including the Drugs Treatment Court and the Drugs Treatment Service of the Probation Service. A Health Diversion Programme implementation group chaired by the Department of Health is finalising plans for the commencement of the programme, including legislative amendments and operational procedures. To support the establishment of the programme, the HSE is expanding its capacity to provide SAOR screening and support for people who are found in possession of any drugs for personal use. I would like to take briefly the opportunity to re-emphasise the points that Minister State Fian said in his opening remarks in relation to funding for the National Drugs Strategy. To highlight it has increased significantly over the last 3 years, and budgets 2021, 2022 and 2023 allocated an additional 21 million to expand the provision of drug and alcohol services, both residential and community-based services. Budget 2023 also provides an uplift of 3.5 million in core funding for community-based drugs and alcohol services in order to maintain existing levels of service. This is the first increase in core funding since 2013. It is also a priority in the National Drug Strategy to develop integrated care pathways and harm reduction responses for high-risk drug users. The high-risk drug users have complex health, social needs, and make them vulnerable to drug overdose and ultimately possibly premature death. And as we know, drugs can have a wide-ranging and devastating effect on communities, which can exacerbate underlying issues of poverty and social inclusion. The Government is committed to a joined-up cross-departmental approach in addressing the complex issues faced by communities, and drug and alcohol task forces have an important role to play in supporting the response to drugs at community level. The drug-related intimidation and violence engagement, known as the DRIVE initiative, is an interagency response to tackle drugs-related intimidation and violence in communities most impacted. It is led by the Drug and Alcohol Task Force in conjunction with An Garda Síochána, the Probation Service, the HSE, Family Support Services and civil society organisation. The initiative has been funded by the Department of Health for a 3-year period. To support the rollout of this DRIVE initiative, funding of 250,000 was allocated in budget 2023 for this purpose. The funding will support his work programme, including the development of a suite of training and capacity building resources, a national DRIVE liaison network, a shared learning network and referral pathways to support for victims, awareness raising, community initiative and targeted interagency programme, and a national data collection system. The Government is committed to the establishment of supervised injecting facilities in Dublin city centre. We have passed legislation and provided resources for this harm reduction and life-saving service. We have identified Dublin City as the optimum location to pilot this service based on the concentration of drug-related deaths in the area. The establishment of the service is subject to the granting of planning permission by An Bord Pleanála. The supervised injection facility is an important public health response to drug-related death and illnesses and will offer a compassionate, person-centred service which reduces the harm associated with injecting drugs use and can help people access appropriate services. The facility will bring drug injection into a medically controlled and supervised setting with health and other benefits for vulnerable individuals. It will also reduce the negative impact of public injecting and drug-related litter on local communities and businesses. In conclusion, we cannot be complacent about the dangers of drug use to individuals, to their families and their wider communities. The Government is committed to implementing a health-led approach which is person-centred and compassionate. The forthcoming Citizens' Assembly on drug use will provide an opportunity to take stock of drugs policy and to identify further improvements for the next drugs strategy. Thank you.
Back to the Labour Party, and it's Deputy Alan Kelly of 5 minutes.
I'm sharing time with Deputy Patrick. This is an incredibly important motion, and I want to commend my colleague Dáil Éireann for bringing so many people along in relation to this over a number of years. It's been a passion of his and something that he has been fighting for based on his own knowledge and personal experience for many years in our Labour Party. And it's now on the floor of the Dáil before a Citizens' Assembly. But really, we need to educate and get the message out that the current policy, our current policies in relation to drug abuse in Ireland simply are not fit for purpose. They don't work. They're not compassionate. And simply put, they are failing society. And they're failing so many people. And one thing I want to stress here today, as somebody who comes from a rural county, is that this isn't an issue just for urban centres. This is an issue right around every village, town and county of Ireland. And I say that with some experience. It's in my own village. It's in my own local clubs. It's in my own town. It's everywhere. Absolutely everywhere. Young people now in particular are taking drugs in a way that was very different from before. Many of them are playing sports, and they find taking certain forms of drugs gives them the high rather than actually taking huge volumes of alcohol. What turns out then, though, is an addiction happens, and they become addicted. And the way in which we are dealing with this issue, the idea that 10,000 people are arrested every year for personal drug use, that's just madness. Absolute madness. You talk to any Gardaí, and I represent Templemore, you talk to any Gardaí and they'll tell you it's a waste. It's a waste of resources. They don't even want to be doing it. They feel sorry for the people. So we really need to change policy. We need to change policy that shows compassion, but also deals with this in a realistic way. This is not about arresting people, and I know we've had changes in recent time in relation to criminalisation and 3 strikes, and that's a move in the right direction, but that's not working either. That's not working for people who are addicted to various different types of drugs. Ultimately, this motion is about people, and it's important to get this message out there. This does not mean we are legalising drugs. Those who engage in criminal activities need to be prosecuted in accordance with the laws in every shape and fashion. What this is about is the ordinary users. What is the point in arresting them? What is the point in doing it as a criminal and justice issue? This is about health. This is about looking after people in a more humane way, and a complete change in policy and getting that out across to the people of Ireland, because I believe at this stage they will wholeheartedly support it. Thank you.
Gurmagat, Chair, and just to say that I'm very glad to have the opportunity to close this debate on behalf of Labour, and to thank colleagues across the House for the strong support that's been shown today for this important motion. I want to start by commending my colleague, Deputy Éireann Éireann, who as our Justice spokesperson, but long before he was our Justice spokesperson, has been leading for us on the policy of decriminalisation and on bringing people with him to ensure that we see a more practical, a more compassionate, a more humane and a more evidence-based approach to drug policy in this country. Could I also commend Labour Youth, our youth wing, who have been to the fore in leading for us within the party on this, and in particular Conall O'Boyle, Hugh Murphy and James Carney, who have really led the campaign within Labour Youth and who are in the gallery, I know, with us. I also want to commend the many frontline support workers working in drug rehabilitation and treatment, many of whom have worked with us on shaping this motion and on supporting it. I want to thank Citywide, I want to thank Anna Liffey, I want to thank Coolmine and Merchants Quay, and commend all the work that's been done there. And in my own constituency, the Ringsend and District Response to Drugs, I want to thank all of those who are working so hard to deal with and to address those who are who are enduring addiction. I should say this is an issue very close to my own heart. For many years I practiced as a barrister. I did a lot of criminal defence work. I did a lot of work in the district courts. And many of my clients themselves were those in addiction. They were in addiction themselves. Many of them had, their addiction had been a pathway into criminality. I saw very close up the immense destruction and devastation wreaked as a consequence of drug addiction. I always think of one young mother I represented in court who was in and out of prison. She was convicted time after time of theft-related offences, stealing to feed a habit, in and out of prison. The only time she looked healthy was when she'd spent time in prison, when she was securing medical support for her addiction. And when I think of the harm caused to all of the victims of the crimes committed by clients of mine, by others, and when I think of the enormous harm to the families of those in addiction, and when I think of the huge physical and mental health impacts upon those in addiction as a result of their addiction, I think it certainly made me realise the need for a change in policy. And I think, Minister, what we're hearing across the House today is a recognition by all of us as legislators in and out of government of the need for a change in policy. And it's very welcome that the government is not opposing this motion. It's very welcome to hear your colleagues speak about the legislation on supervised injection facilities, which has been in place since 2017, driven by my colleague Deputy Éireann. It's very welcome to hear the may I say, somewhat lip service given to a health-led policy to addiction by this government. What we're not seeing is the drive and the political will necessary to deliver that really necessary change in policy to a health-led, evidence-based approach, to a policy where we can decriminalise the user, where we can see addiction as a health issue and put in place the necessary state supports to bring people out of addiction, to rehabilitate people, to treat it in a compassionate way as a health-related issue. This is an issue across the country, and my colleagues have pointed this out. I was in Limerick recently with Anna Liffey. They're telling me that all across, not just in urban settings, but in rural settings too, we're seeing this. It's an issue in my own constituency, where recently in the South Inner City, I've met with communities, businesses and households really impacted by the devastation wreaked by criminal gangs, drug gangs. We need to move it out of this. The war on drugs has not been won. The criminal justice approach is not achieving the necessary results for communities and for individuals, and we need to move to a different approach. The criminal justice approach, a criminalisation model, has not stopped criminal gangs from terrorising communities across the country, urban and rural areas alike. It has not stopped the people using drugs, because we're seeing, as our motion points out, widespread usage. It's not stopped people dying, and indeed the figures are very stark. Over 10,000 lives lost in the last 25 years in this country as a result of addiction, and that's a really, really dreadful figure that we simply cannot continue to tolerate, Minister. We've moved beyond we've moved to a situation where we can now talk very openly about deaths due to subjects that were perhaps stigmatised in the past around suicide and so on. But now we need to talk about how we save those lives, how we save families whose loved ones have been lost through addiction. So criminal justice policies have not prevented deaths. And what they have done, unfortunately, is created unnecessary stigmatisation, in particular of young people. We're seeing so many prosecutions, so many arrests and so many convictions for possession for personal use. As others have said, this is not a good use of Garda time. This is creating unnecessary stigmatisation for young people, and particularly in disadvantaged communities. In 2020, a pandemic year, nearly 15,000 arrests for possession of drugs for personal use in this country. This is, again, not the right way to approach, not a practical or a compassionate way to approach issues around addiction that should be dealt with as health-led policies. Minister, in your own speech, you referred to the electric picnic model, what happened this year with the electric picnic, and the pilot model of adopting what was genuinely a health-led approach, where we saw the HSE launching a landmark drug testing facility, enabling festival goers at the electric picnic in Laois to forfeit their drugs anonymously for testing. What we saw was huge media focus on this and on the various pitfalls that were predicted, but the programme was a success by any measure. Dangerously potent substances were found in some of the samples submitted, including 3 entirely new psychoactive substances. The findings immediately led to 3 communications to festival goers advising them of risk, and that experience speaks for itself. It speaks to how a genuine harm reduction model can save lives and can provide a new and better approach to drug policy. Can I finish, Minister, by noting that this is not a new debate, that in 2015 I was a member of the Oireachtas Justice Committee. We produced a report which again achieved a cross-party consensus on the need to move to the Portugal model, which others have spoken about, of decriminalisation of the user. Let's see the government grab this metal, take the initiative now, Minister, and let's see you name a date for the setting up of the Citizens' Assembly. There is huge support for it across this House. Just name the date. Before Christmas, let's hear a date being set so that we can move towards a genuine, compassionate, evidence-based and health-led approach to drug policy in this country.
A cheachtas sin déirnis leis an tí spóracht mother leis an Tairskent mother libertas drugaí agus an túsador a dhí chóir úlú. The question therefore is that the motion be agreed to. Is the motion agreed? Motion is agreed. Guramagiv.
The fiasco surrounding the delivery of the National Children's Hospital continues. It's a saga that has